Hi everyone, this is Clara from Wellness Embodied. I'm one of the physiotherapists here. This is, I think, our fourth Facebook Live that we have done so far. Today we're going to talk about post-concussion syndrome and its management and common symptoms and signs and what we do here at the clinic to help you feel better if you had a concussion. So in the previous videos we discussed what concussion was, what are the common signs and symptoms that you need to look for after you had a head impact. We also discussed what to do if you have a concussion, that is mainly seek a health professional, seek for help. We specialize for possibly in concussion, so they can guide you through there. They can rule out if any other damage is in there and if it's only a functional dysfunction and it's my brain injury or concussion, they will guide you through what to do. So once you get a concussion and you get symptoms after that, we say you're on an acute stage of a concussion, and after 2 weeks, if your symptoms are still there, we call it post-concussion syndrome. So that means you have initially concussion, symptoms, you did everything you had to do, or sometimes you didn't, and the symptoms remain longer than what they should. That means 2 weeks longer you're still experiencing fatigue, dizziness, headaches, balance issues, lightheaded, visual symptoms. You feel you're not back to be the same that you were before the injury. Your sleeping pattern is not good. Your mood is constantly changing. All those symptoms means that you might be going through a post-concussion syndrome. So it's very important at that stage, even again, to look for help. Describe symptoms to a health professional, especially if they know about concussion treatment, and start searching for the cause, because obviously we know there was an impact, but not everybody develops a post-concussion syndrome. There's only 30% chances of you developing and prolonging your symptoms. So if you are within that 30%, means that you need to do a further assessment and further treatment to help you to decrease your symptoms. So what we do at the clinic here, you will come in, we will ask you questions about the injury, how did that happen, if you're working or not, if you do any sports or not, because we need to guide you and try to get you back to normal life as soon as possible. The main reasons why you might have longer symptoms after 2 weeks are 3 of them. So one is a physiological one. That means after you had a head concussion, you probably the blood flowing towards your brain is not the same. So that could be one of the causes why you keep having these symptoms. So the other option is that your symptoms are coming, your headaches or dizziness or balance problems are coming from your neck. So we also need to check for that. And the third option is that your vestibular system, that means the system that is in your inner ear and controls your balance, could also be affected. So here at Wellness Embodied, we have very high qualified specialists, or actually physios interest in these areas particularly, that have a lot of experience with this type of symptoms that will help you to recognize them and recognize the cause. Once we find the cause, we can definitely treat it and you can definitely forget about the concussion forever pretty much. So if the reason why your symptoms are still there is because the blood flowing to your brain has been reduced, what we do is what we call buffalo test or treadmill test. So we put you on a treadmill, starting to run, and slowly and progressively we start increasing that load for you. And if you develop symptoms, what you do in the test means that possibly you're still feeling sick because there is a blood reduction on your brain. So what we do is we try to guide you and push you back to exercise as soon as possible. We have a protocol that will help you to exercise, to keep your fitness level high without increasing the symptoms. The second option, as I said before, is that your cervical spine might be affected every time, as we talked on the previous videos, every time you have a head impact, your neck will suffer whiplash. So that means a big movement that can strain and change the normal functioning of your ligaments and muscles in your neck. So we do different tests to try to differentiate that. And then obviously we are physio, so we can do hands-on treatment and also give you good exercises to get your neck stronger and more stable. The third option, as I said before, it was the vestibular system. That one, we have one on each side, lives in your inner ear, and when it's affected, you get symptoms such as vertigo, dizziness, blurred vision when you move your head, lack of balance, and all that. So we do an assessment there too. We have certain equipment that help us to differentiate if the symptoms are coming from the vestibular system. And as well with physios, we are trained in that area, so we can give you a lot of exercises to help you get better. And actually, I forgot to mention initially, but there is a fourth reason why your symptoms might still be there, and is the metabolic reason. So we always put patients into an anti-inflammatory diet and help them to go through that to avoid the inflammation to stay for too long. So obviously it's very important. It's not like we can give you a tool. Every treatment is different for each person because not everybody does the same work, not everybody does the same sports, and not everyone with a post-concussion syndrome but will have the same symptoms. So even though you want to research about it, you want to learn about it, it's very important to find an appropriate health professional that can guide you and make it very specific and functional for you. So if you guys have any more questions about post-concussion, if you know anyone that has had a concussion, you can always send us an email or write underneath some comments or give us a phone call. We are all very happy to help you and answer your questions. We also have a blog on our website that is wellnessembodiedcairns.com that we have put plenty of information there because sometimes reading that information helps you to find and understand a bit better what's happening with you. And sometimes we have some samples from patients and stories that might help you to recognize your symptoms a bit easier. But definitely if you had a concussion, you need to search for help, especially if your symptoms are staying longer than 14 days. Well, I hope you like it and let me know if you have any questions. Bye!